Kia ora, I'm Dr. Rebecca Garland.
This is a video that will explain the basics about cholesteatoma, which is a common ear problem that ear doctors often see. So to begin with, what is cholesteatoma?
Well, that's a good question. Cholesteatoma is a collection of skin. There's already skin in your ear, on the eardrum, and cholesteatoma is when the skin gets trapped in a different part of the ear and starts to form infections.
Okay, and how does it exactly form?
There are two main ways that it can form. It depends on what part of the eardrum is affected. So this main part of the eardrum here is where people who have lots of problems with a tube that pops and clicks their ears, we call that the eustachian tube, that is sometimes blocked and the eardrum can become sucked in. That becomes a bit like a shrink-wrapped ear, so that, you know, when you have vegetables in the microwave and you put plastic on it and then it sucks in, and the skin of the ear then becomes trapped in all the nooks and crannies where it's been sucked in. Then that vacuum means that the skin of the eardrum is pulled in almost like a deflated balloon. Once the skin gets trapped in that balloon part, it then grows and grows and gets bigger and bigger into other parts of the ear.
Okay, so you mentioned that some people will have tubes that don't work quite well, like click a bit more. Why do some people get them and not others?
That's a question I wish I knew the answer to. Unfortunately, no one really knows the answer to that. Some people do have problems with infections in the back of the nose and in the ear. Sometimes it could be related to things like nasal problems, like allergy, that can coexist with cholesteatoma. But other times people have no risk factors. Some things that we can control are things like smoking. So smoking can damage the delicate linings of the tube and the area around it, and that poisons the little hairs that help to shift the mucus. So things like stopping smoking can help, but cholesteatoma also occurs in people who don't smoke.
Okay, and if someone did get a cholesteatoma, what are the kinds of things that they would experience?
Yeah, so that's a good question. Often people don't notice that they've got a cholesteatoma, and that can make it really hard to diagnose. Things that commonly present are leaking from the ear, so people getting infections. Sometimes they're painful infections and sometimes they're painless, and mucky discharge or runny stuff comes out the ears, can be a bit smelly. Those infections are, once that skin's trapped, those infections form from the skin getting trapped and maybe some water getting in and making that skin soggy and then causing an infection. So sometimes the infection might clear up with some drops or antibiotics, but the underlying problem of the skin is still trapped there. So then sometimes the infection can come back again. Otherwise, other people don't get infections and they just notice hearing loss. One of the things as the cholesteatoma goes in is it can damage the little delicate hearing bones, and that can cause a hearing loss. In addition, there is a nerve that goes through the ear that supplies movement of the face. If that nerve is damaged, it's called the facial nerve, and like its name, you can tell that it moves the muscles of the face. Damage to that nerve can mean that the face might droop.
If you have any questions, please ask your ear doctor for any further clarifications, and they'll be happy to help you. We wish you all the best with your treatment journey.
Ngā mihi nui.